The urinary system is an important part of the body's ability to cleanse itself from toxins and maintain fluid balance. Think of it as the blood filter of the body. It is composed of the kidneys, ureters, bladder, and urethra. The blood is filtered in the kidneys, which produces urine that moves down the ureters and gets stored in the bladder. Through the urethra, the fluid is then urinated. Note that the urine produced from the kidneys does not contain any microbes, and as such, the urinary system is able to remain sterile from bacterial growth and infections. A urinary tract infection, or UTI in short, is the infection of the urinary system by harmful microbes such as bacteria. It can develop in any part of the urinary system and even spread to the rest of the body. Commonly, the cause for a UTI is the introduction of harmful microorganisms to the most exposed parts of the urinary system, the urethra. Then, the infection can spread upwards to the bladder and kidneys. Most common symptoms include pain or a burning sensation during urination, more frequent urges to urinate. Some also report the feeling of pain or discomfort in the lower abdominal or groin region. It is also possible to notice bloody urine. Not all UTIs lead to symptoms. Some may develop a urinary tract infection without experiencing any symptoms. UTIs are more common with advanced age and are more likely to develop in females. Furthermore, there are a few factors that are known to increase the likelihood of developing a UTI. For example, diabetes, being sexually active, kidney stones, recent use of a urinary catheter, and last but not least, poor hygiene, which includes poor menstrual hygiene in women, which can lead to the growth of harmful bacteria around the urethra. During an evaluation by a doctor, the common signs and symptoms of a UTI will likely prompt a urinalysis. This is a test where we take a sample of urine to the lab to assess for a wide range of chemicals and bacteria. A urinalysis is usually sufficient to include or exclude UTI as the cause of symptoms. As for treatment, since the most common root cause of a UTI is a bacterial infection, the cornerstone of treatment is antibiotics. The type and duration of antibiotics is based on the causing microorganism and severity of disease. There are a few steps a person can take to improve symptoms or avoid the development of UTIs. This includes staying well hydrated with water, practicing good hygiene in the groin area, not holding back urine when the urge arises, and some studies have shown that drinking cranberry juice can help against bacteria in the case of a UTI and reduce the chances of recurrence. With appropriate treatment and early intervention, UTIs are reversible and can heal soon after treatment. Without treatment, however, a UTI can spread to the kidneys and lead to permanent kidney damage. Or, the infection can spread into the bloodstream, leading to a condition called sepsis. The higher the infection has spread in the urinary system, the more dangerous it is. While UTIs are not life-threatening, the spread of the infection to the blood is, and therefore must be taken seriously. Finally, UTIs are not contagious or considered sexually transmitted. However, a person may expose their partners to UTI-causing bacteria during intercourse, and therefore caution is advised. It is best to seek medical assistance if you experience any of the mentioned symptoms. With that, we hope you have a better grasp of urinary tract infection.